evening. Thank you for joining us. We're just letting people in the room. Good evening. Hi, my name is Sam Fletcher, and I am the Executive Director of the New York State Chapter of NASW. Thank you so much for joining us tonight for our chapter chat. So this chapter chat is going to be given to us. Oh, I'm so sorry about that. By Sarah Murdoch. She's from the Medicare Rights Center. We're all really excited to hear about this great resource and learn a lot. For those who haven't joined us before for a chapter chat, this is something that we created at the beginning of COVID as a way to socially connect while we're physically distanced. This does not have CE credit attached to it. We do have several CE options that I can put the link in where you can find those in the chat shortly. But this one is not CE, it's a chapter chat. We do record our chapter chats so people who aren't able to make it live are able to watch it later. So how are you going to interact with us tonight? Okay, so if you're not familiar with Zoom, I imagine almost everyone is during COVID. You can click on view, which is in the top right-hand corner of your screen, and you can change to see only the speaker or to see everybody. So that's one way you interact. I have turned on the closed captioning. They should be at the bottom of your screen for anyone who may be hearing impaired or need the words on there. You can change your closed captioning by clicking on the icon at the bottom of your screen. You can turn them off so that they're not in the way of the slides if they become problematic. You can also on the bottom of your screen use reactions like hand claps, hearts, different things. If you see something you like or you're enjoying hearing something. And you can also use the chat feature, which is at the bottom. So Sarah is going to present for us for probably about half an hour, maybe a little longer. And then at the end, there'll be time for questions. When we take questions, you can either type your question in the chat or you can unmute yourself and speak directly to Sarah. We like it to be natural, so please feel free to talk to Sarah. I'm sure she would like to hear. So I'm going to be quiet now and hand it over to Sarah so that we can learn more about Medicare Rights Center. Thank you, Sarah.
Thanks, Sam. So I'm just going to go ahead and share my screen so I can show you our PowerPoint. Is that good for Sam? Is that good? Okay, great. So this presentation, we are the Medicare Rights Center. I'll give you a little bit of background on our organization, but this is to give you an overview of the resources we have available to you as social workers, also just the public in general, your clients that are out there just to help kind of navigate, again, the Medicare maze. So I'm the Director of Client Services. I oversee various programs, including our National Consumer Helpline, the casework that we do, low-income benefits, a variety of things in New York State, just as a kind of sneak peek. The Medicare Rights Center, we are a national nonprofit. We're based in New York City. We're consumer-oriented, so we are focused on ensuring that Medicare beneficiaries have access to affordable health care and individuals with disabilities. So we do that through counseling and advocacy. So that's specifically things like our helpline, that casework, things like that. Educational programs, so presentations like this, also some of the resources I'm going to go through, and then our public policy initiatives. We work both on the federal level and the New York State level to strengthen and protect the Medicare program and make it better for people who are enrolled or will eventually be enrolled in Medicare as a health insurance. So our resources, this is just kind of an outline and we'll go through all of these in more detail, but Medicare Interactive, it's a huge online resource with a variety of topics. We have different newsletters that have different focuses depending on what you're interested in or what your needs are. We have Medicare Minute and other webinars. We do have courses that have CEs associated with them for social workers through NASW New York. Our helpline is available to all of you. And we do have a professional email TA box available to social workers. So we'll just go through these. We're going to go through kind of what Medicare Interactive is and how that can be helpful. Again, going through what Medicare Minute and the other kind of presentations we have that can help you better serve individuals in the community, and the variety of free resources we have, and then how our Medicare Interactive Pro, which is our webinar series, can help you kind of get more intensive training on the Medicare program. So we'll start with Medicare Interactive. Medicare Interactive is an online resource. You can access it on any device, your laptop, your phone, your tablet. It's just a way to have quick reference for Medicare questions. So you can type in any Medicare topic. It will guide you to articles that can answer that or guide you, provide an overview on the topic at hand. Again, it's web-based. It's meant to be really easy to navigate so that anybody in Medicare or professionals, or no matter what the audience is, can use it to help solve their problem or understand an issue. It's written in consumer-friendly language, and it's on all types of different topics. So it could be enrollment, coverage, different Medicare options, low-income benefits, coordination of benefits, anything that you could really think of. Is probably in Medicare Interactive, and we do get over 3 million visits to this. It's continually growing annually. We use it in our own work every day on the helpline, so it's a very useful tool. On Medicare Interactive, you can register for your free account. One of the benefits of this is you can bookmark things, download resources, newsletters, things like that, get discounts on MI Pro courses. So it's easy to sign up, and again, it's free to register as a free account through Medicare Interactive. We do have Medicare Interactive guides. So again, these are downloadable resources. They are more like a deeper dive into a specific topic. You can share it with clients or have it for reference for yourself. The current guides we have include sort of Medicare overview for 2021, preventive care, and appeals for Part B or Part D premiums, things that we commonly see on our helpline. We also have Medicare Interactive Toolkits. Again, these are also downloadable resources. They include PowerPoints and handouts. They're also very specific on a topic, kind of to help people troubleshoot if they're experiencing a particular issue. So these current toolkits include coverage of behavioral health, so mental health services, substance use disorders, things like that. We have advocacy toolkits, so how to help people enroll in Medicare, access certain services like durable medical equipment, DME. We also have a toolkit on coordination of benefits, so how Medicare is working with employer coverage or COBRA, or retiree coverage, and how people can maximize their benefits that way. And then we have New York specific toolkits. So one that gives an overview of options for dual eligible people, meaning Medicare and Medicaid, and people that are transitioning from Marketplace to Medicare in New York State. So Affordable Care Act, qualified health plans, Medicaid through the Marketplace, people that are moving to Medicare from those type of things. We also have a variety of newsletters that you might find helpful. They just come directly to your email that you can sign up for if you register for a free account. Medicare Watch is our weekly policy newsletter. So that's kind of anything that's sort of happening in the moment in the more federal level, I would say. Rule changes, we've had a lot of Medicare kind of things happening during COVID. So that's kind of a way to stay like really current on issues. Dear Marcy is a bi-weekly consumer oriented newsletter. So it's more like people asking questions about how is this covered, or how can I access certain things, or how do I enroll, things along those lines. We also have Medicare Rights New York. This is the state policy newsletter, similar to Medicare Watch, to help people stay current on what's happening in New York State. And so, yeah, so all of these are meant to be kind of up to date. Other things are updated, but these are more like if things are happening in the moment. We also have Medicare Minutes. So this is a free presentations we have. They happen, you can also get access to them through Medicare Rights and Medicare Interactive. They happen monthly, and the topic changes month to month. So it's also a way to get additional information on revolving topics, and it's free. One that happened recently is Medicare coverage of care at home. And you can sign up for that at your convenience. So the Medicare Minute, we've had this program for quite a while now. It started in 2001. It's been continually expanding. It's used through the state health insurance assistance programs. We use it, different nonprofits use it. So it's a great outreach tool. It's a great webinars to help people if you're working with Medicare beneficiaries or for the beneficiaries themselves. So this is more about the services we offer. So we have a national consumer helpline. It's open Monday through Friday. Staff and volunteers participate on the helpline, work on the helpline. Everybody is, the helpline is still fully operational, even though we're all teleworking right now. So we help thousands of callers a year. We answer about 20,000 questions on the helpline annually. So we're always there as a resource. If you have a question as a professional, if your client or beneficiary wants to call us directly, they can do that as well. And we answer just a variety of questions. So understanding benefits, enrolling, we screen everybody for benefits that would help them pay for premiums or co-pays or prescription drugs and things like that. And then can assist them in applying for those if they're eligible in New York. And then it's really for anybody. So it's not just beneficiaries, they're caregivers, friends, family members, professionals, whoever. This helpline is open to everybody. So it's free, and that is the helpline number there, 1-800-333-4114. So I don't know if this video, I'm just going to share this video real quick. It features a client story.
Should we hear audio?
Can you not hear the audio?
No, you can usually click on the view options at the top. There's usually like a little button that says something like share audio or something like that at the top where it says view op. Maybe yours says, maybe it's where it says.
Yeah, sorry guys. Share sound. Share sound. Let me try this again. Can you let me know right away, Sam?
Yeah, we hear it.
Okay.
I was raised to always take care of someone, so I'm always giving. I used to work in school nursing, taking care of children with disabilities. 29 years ago, I became very ill while at work, and they discovered that my liver was failing. I was 36. My sons were 7 and 9. I was fortunate that I was in the right place at the right time. So May 1st of 1990, I received a liver transplant. I thought I would have been dead at age 40. I saw my sons graduate high school. I saw them graduate college. I have a granddaughter that's 18. I saw her being born. I raised her, and I spent a lot of time with Ashley. I didn't think I would have lived to see retirement, so to be 66, that's a miracle for me. When I was turning 65, I had no idea that my insurance was ending. They never notified me that the insurance doesn't continue. I had no knowledge of it. So I was frantically making calls because my transplant medication I need to take for the rest of my life. I would have had to pay $900 for one medication for 30 days. And that was $900 I didn't have. I was terrified. I would have gone into rejection without my medication, and I could have died. But if it wasn't for the gentleman that asked me, have you ever heard about Medicare Rights Center? And I said, no. He said, call them and see if they could help. He gave me the telephone number, and there was this calm voice on the other end of the line.
Melissa called our helpline. She had a few concerns that many of our callers have, and I explained to her that because she was turning 65, that she could no longer keep the same insurance. And so I helped her kind of navigate the transition into her new insurance and made sure she understood what her options were and how her insurance worked.
Currently, as people are approaching Medicare eligibility, they do not receive a formal notification about their Medicare eligibility. And so Medicare Rights has been advocating for improving the Part B enrollment process. We take what we learn from people with Medicare and we advocate for improvements to the Medicare program.
A lot of people who call our helpline qualify for these benefit programs and they don't even realize it. Things like the Medicare Savings Program, Extra Help, Epic.
That program would pay the premium, but also to cover my medication because I had a low income.
Just last year, we helped clients save close to $6 million in prescription drug costs and Medicare premiums. Not only are they able to get their medically necessary treatment, but it helps people afford the cost of daily living.
Our services are completely free. We're really fortunate to be able to get funding to do the work that we do.
With the help of our supporters, we've been able to help millions of people with Medicare through our helpline, our educational resources, and our public policy initiatives.
Even people who are very educated have confusion and issues navigating the Medicare systems. And she's someone who is very smart and she's an incredible advocate for herself.
I'm in the nursing profession. You're on a different side of the fence. You're not that healthy person. You're not the one giving the care. You're the one needing the care. And she did take the time to care for me.
She had a month where she had a gap in coverage before her prescription drug plan became effective. And so by accessing these drugs through this limited income net program, she was able to pay very low cost for this critical medication.
My medication does not stop coming. So the 30 days that I would have gone without medication, Medicare Rights Center saves my life. So they have become part of my miracle.
She's a really strong, resilient person, and she still keeps a really positive attitude. We only speak to them for maybe a short period of time, that we can really have a lasting impact on their health and quality of life through the work that we do.
I didn't want to be emotional about this, but she did touch my life that day. And I really appreciated what she did.
So thanks for watching that. I think Melissa's story is very exemplary of the kind of things we see on our helpline, the kind of issues we see with access, affordability. And that video, Rachel Schumann is one of our wonderful social workers as well at the Medicare Rights Center. So there's that. Oops, sorry. So another resource we have available is we do have a professional TA technical assistance box, professional@medicarerights.org. If you ever have any Medicare question, large or small, we would encourage you to email us. We'd be happy to answer your questions or help you troubleshoot a situation. Try to limit your email to one Medicare question. So if you have multiple clients, try to just send one per issue, and then we'll get back to you within 2 business days with additional information. So, sorry. We also have Medicare Interactive Pro, MI Pro training. So we have a partnership with the wonderful NASW through New York State. MI Pro is a webinar series. It is available at a more discounted price through NASW. This is where it is, but I think if you need more kind of guidance finding it, Sam can help you guys. But this is sort of like what you would see if you're looking for it. They are in New York, there are continuing education associated with this. So just depending on the class you take, it could be more credits. This is sort of just a breakdown of the credits per class. Some are more intensive than others. So MI Pro, it's web-based, it's an interactive curriculum. It has all different kinds of topics and different levels, and it's available to anybody. And again, it's available through NASW. at a discounted price. It is available on our website as well, just to whomever, and help people navigate Medicare issues. So there's 4 levels. It has 4 to 5 courses per level, just depending on the content of that level. There's quizzes and supplemental materials. They're really great resources. And it's just been a continually evolving and growing kind of resources over the 30 years that we've been existing. We use this to train our own staff, to train our own volunteers. So I would encourage you to check it out. So I think just a main takeaway is why even look at these at all. Medicare is constantly gaining new participants. Over 60 million people are already enrolled in the program, and 30% are receiving coverage through Medicare Advantage, which we have a lot of information on our website about. The Medicare population is growing every day, so 10,000 right now baby boomers are retiring or aging into the Medicare program every day, and so there's continually questions and continuous enrollment in the program. So with MI Pro and all the other resources, you can just build your knowledge and kind of have an understanding of how the different pieces work together, and know where to go when you need to ask a question or have a problem. Medicare is very complex. You don't need to be an expert. That's why we're here for you, but it helps to kind of have an overview of the program, just given how many lives it touches of clients and people in the community. So here's just more on like how to get to the courses. I think, can share the slides. These are the different levels. So Medicare Basics, you can kind of take one or all of them. It's, just up to you. But Medicare Basics, coverage, appeals and penalties, and then other insurance and assistance programs. So these are kind of the main things we see over and over and over again on our helpline. So that's why the courses are kind of structured this way. So again, level 1, it's kind of just an overview, a gateway to understanding Medicare, and different fundamental components and kind of the regular terminology and lingo that you'll hear when people are talking about Medicare. Level 2 is Medicare coverage. So this is based on more of like what's covered under Part A, B, C, and D, the different pieces of Medicare and how people will be experiencing that and enrolling in the different pieces, and the different coverage options. So original Medicare and Medicare Advantage plans. Level 3 is appeals and penalties. So this is more when a medical service has been denied for some reason, kind of understanding how people can appeal that to get coverage, how to navigate that, and then navigating issues related to penalties. So there are a variety of penalties. I'm not going to go into that now, but this course would be great if you want to learn more about that. And then other insurances, so how it coordinates with other types of health insurances, different low-income assistance programs that are available, on the federal level, on the state level. It's a good resource in that regard. And again, as I mentioned previously, you can use any device you want, that is convenient for you to access this, and it will work, seamlessly across devices. And it's meant to be interactive. It's not just like a recorded webinar. It has quizzes and supplementals and like pop-outs and things like that. So it's kind of a great interactive tool. And then another thing is it includes a lot of case examples. So it's not just kind of like dry information. It's including case examples that we witnessed on the helpline, kind of helping you sort of treat it like it was a real client and work through it kind of as if you were actually working with this person. So that is it. I mean, we can open up for questions. So again, here's just a summary of the resources. The helpline, as I mentioned, is open Monday through Friday. The phone number is there. If for some reason you don't get through to us, you can always leave a message. We do call everybody back. We have the professional at Medicare Rights Center email address, MedicareInteractive.org, the different newsletters, and MI Pro that we have this partnership with NASW. And you can also email me questions, and I'm happy to answer any questions right now.
Does anyone have questions for Sarah? You can feel free to unmute yourself and ask, or you can type them in the chat box if you would like. I did put a link to our CE schedule, our chapter chat page, which we record all our chapter chats, so you can watch any of the last ones, and this one will be added to the page probably early next week. And I also put the link in for the self-study that Sarah was referring to, that we partner together on.
I have a quick question. So I am currently a student, a social work student. So the credits that are given in these trainings, will that pertain to me, or is it after I graduate? And
So
what state are you in?
I'm gonna be first year MSW.
Are you in New York?
Oh, you meant what state? New York.
Yeah, New York. Okay, so the credits don't apply to you at all.
Okay.
In New York State, once you get licensed, you don't need CEs for 3 years. And then at the end of that 3-year period, then you need 36 CEs every 3 years, but you can't take the CEs early. So like if you took them, they wouldn't be valid when you need them.
Okay.
Good question. Sorry, Sarah, I actually knew the answer to that.
that's okay. Great. Yeah.
Thank you.
You're welcome. Any other questions? So Debbie says thank you. She has to hop off, but she's looking forward to all these great resources.
Great. Thanks, Debbie.
Okay, I have a question came in of how do social workers typically use the information that's given in the trainings? How do they typically use that information with clients?
So the trainings, like the webinar trainings, or is that?
Yeah.
So it just kind of depends on what your, what area of social work you're in. So I mean, a lot of people that are maybe working in the aging field, like you might kind of be able to guide people on issues. If you're not kind of directly working in aging, sometimes it's helpful to just kind of recognize that somebody even has an issue, because you have the background knowledge on it, and then know where you can refer them to for help or know where to go to get information. So it kind of just depends on what specifically your role as a social worker and what your organization is. But yeah, so I mean, a lot of, for example, organizations we work with in the city, are actually maybe helping people with coverage issues or helping them work through denials or helping them apply for benefits, kind of having an understanding of those things, how they relate to the kind of bigger picture of Medicare is often helpful.
Thank you. And I have a new question came in. I work in dialysis. Is there anything dialysis specific in the trainings or any good dialysis Medicare resources that you know of?
So we do have on Medicare Interactive, and I think in our toolkits, we do have different things related to end-stage renal disease and Medicare eligibility. So kind of the eligibility rules, enrollment, their coverage options. So I think you can poke around on our website, Medicare Interactive, and also in the toolkits. And then also the helpline, if you ever have a question, you can call the helpline specifically, or if you have a patient that's having a specific issue, we'd be happy to discuss that issue with you. But yeah, through Medicare Interactive and the different toolkits and downloadable resources, there's a lot of end-stage renal disease / dialysis information.
Great, thank you. Another question, how often are these trainings updated and how often do the rules change with Medicare?
So the trainings are updated anytime something changes. So they're constantly being updated. The same with Medicare Interactive. We have an entire education department that's always on the lookout and monitoring you know, the rules, legal changes. Our policy team is monitoring that, you know, on a literally daily basis. So anytime there's a change, stuff is updated almost immediately.
Hi, good afternoon. This is Millie, and I have a question, if that's okay.
Sure.
Okay, great. So I've actually I work with senior adults, right? And I've been wondering about those commercials on television that tell, tell seniors that they are entitled to a million different services. Those commercials always seem a little scammy to me. And I know that I've had clients call me and ask me about those. Is there any legitimacy to any of those commercials? Because the fine print is just so small that I always feel like they're just trying to reel you in for something.
That's a great question, and I think your intuition is correct. I mean, it's a commercial. They're probably trying to sell you something or enroll you in a plan. You know, like plans. You know, there are great Medicare plans, there are bad Medicare plans. So we would encourage people not to just like, oh, I saw it on TV, I'm going to enroll in this. There are a lot of free resources. So every state has a state health insurance assistance program that can help people look at all of the options, not just the options with a particular company or the options from a particular commercial. So we would encourage people to reach out to those kind of unbiased resources for information rather than just seeing something on TV, because, you know, commercials, they have an incentive. They're trying to make money off people. But, you know, some are scams, some are legitimate commercials for real plans. But people should be cautious and not just do, you know, whatever they saw on TV.
Awesome. Thank you so much.
Yeah, no problem.
Any other questions? What is the unbiased number for insurance issues?
Sure. So depending on the state, you can go to a website called shiptacenter.org. We're part of the SHIP TA Center in New York. If you're not in New York, it has like a orange tab that you can go and it will go to your state and show you the helpline for your state. So those are all either run through, depending on the state, like either the Department for Aging or Department of Health, or and then there are usually nonprofits associated with them that are doing that counseling on the different options. But it's State Health Insurance Assistance Program, SHIPS. So shiptacenter.org. We're also happy to explain options on the helpline, although we wouldn't get into the specifics of individual plans, but we could give an overview of original Medicare versus Medicare Advantage, answer questions about those as well. And we are a nonprofit as well.
Okay, so we have another question. How do you access home services like a companion for a patient that has Medicare as secondary insurance? I was told that Medicare needs to be the primary insurance in order to get that service. Is that correct?
So Medicare doesn't cover unskilled care, so it wouldn't ever cover just companion care. Medicare covers things like home health. So if somebody needs skilled nursing, physical therapy in their home, they might be able to get home health aides kind of adjacent to that, but it's never going to cover just somebody who's helping with activities of daily living. That is typically through Medicaid, and people would need to reach out to their state Medicaid program to see what the eligibility is for that. In New York, people have to be assessed for that, enroll in a managed long-term care plan, and go through a specific process. So if you're in New York and have somebody with that, we can help with that. But if you're in a different state, you can reach out to local Medicaid.
Thank you. These are great questions. Any other questions? Just want to give people a few seconds in case anyone's typing. We've had a lot of really good questions, lots of great information. And then I do believe you provided Amelia with a resource guide as well, right?
Yeah, I think my colleague Jay and Dean may have sent along like a tip sheet and resources flyer, excuse me.
We will definitely post those when we post the recording. And our friend Ekaterina, who comes to a lot of our programs, is asking, is the number you mentioned for the unbiased info in New York State Health Insurance Information Counseling and Assistance Program, is it 1-800-701-0501?
I don't know the HICAP number, but if you have the phone number for HICAP, HIICAP, that is our New York State SHIP. And they have different county offices, and we're part of that as well.
Great. Yeah, and that's what also Hayen had also put that on. Ekaterina says thank you.
Thank you.
So we will be posting this recording. We will also post the handouts that were sent to us. Just want to give people a few more seconds if there's any other questions. Sarah, do you have any last words or advice or anything for everyone?
I mean, just call us. We're happy to help. We're here to help. Or email us at thatprofessional@medicarerights.org. We'd love to hear from social workers. I'm a social worker. Our president's a social worker, so we're very social work oriented and would love to hear from you all.
Oh, that's fantastic. That's really good news. So we've had a few people join us late. No worries. We record these. I have the link. If you scroll in the chat, you'll see the link. There's a link that says CE schedule. Then there's a link that says chapter chat webpage. That's where this will be posted. We'll post this on our chapter chat webpage. It's free. You can access it there. And we'll also put the handouts on there that I was referring to. And then I also included the link to study CE programs that we partner with Medicare with. Oh, and we have a thank you from Connecticut Choices Program. Welcome, Connecticut.
Thank you.
All right. So if we don't have any last questions, then we will wrap up. But thank you so much, Sarah. This was so informational and everyone had such great questions.
Thank you. Thanks, Sam. Thanks for having me.
Thank you. I hope everyone has a great night and I hope we see you at our next chapter chat.